Thank you so much for joining me this morning. My name is Jennifer Baker, and for those of you that have not had a chance to participate in one of the webinars or workshops I've done, I'm your newest legislative advocate. I work with Dave Walrath at Murdoch, Walrath and Holmes, and I have had the pleasure of working with you since just prior to the pandemic. And I'm here this morning to share some information with you on California's Master Plan on Aging. I'm going to have a lot of technical and important information to share with you this morning. I just want to say thank you for taking the time to join my workshop this morning. I hope you enjoy it. I am going to have questions at the end. So if you do have questions, feel free to type them in the question box or save your questions to the end. But let's go ahead and get started because there's so much to share and I want to make sure that I can get through it. I'm going to talk about the Master Plan on Aging because this is a new topic for quite a number of you, and I want to make sure that you understand what that is. And I also want to integrate how will the Master Plan on Aging impact both current and future retirees, and what are going to be the next steps that the governor and the legislature are going to propose or implement so that you can be aware of what's going to be taking place in the future. So with that, let's get right on into what is the Master Plan on Aging. And so I really have to say congratulations. The boomers are booming. If you didn't know, the boomer population, the new seniors are the fastest growing population in our state. And that is changing a number of conversations that are taking place in Sacramento and elsewhere. So the great news is you're extremely popular. The bad news is that we're having some systemic infrastructure dilemmas, and hence the discussion and creation of this new Master Plan on Aging. So what we've had take place was that in 2019, Governor Newsom had issued an executive order. And in that executive order, he had directed our Secretary of the Health and Human Services Agency to create a strategy to, quote unquote, protect the health and well-being of older Californians. Essentially, California's leadership saw the demographic changes that were taking place and realized that we needed to have a very strategic approach across the state in order to prepare for that. So hence the executive order that took place in 2019. Once that was issued, a number of individuals within California's effective state agencies came together to deliberate and collaborate on who should be included in the plan. The 10-year blueprint was released in January with 5 proposals that I'm going to be going over. But what had happened was, as you know, when we, just a little after 2019, we suddenly had a pandemic. And so initially, when the Master Plan on Aging started their meetings, there were a series of public meetings that began to take place. I'll call that in the before time. So when I was actually able to go in person or participate in the office, there were a number of stakeholders from a myriad of groups that were participating and listening in to meetings and deliberations that were taking place through the Health and Human Services Agency. So you had organizations that were specifically representing retirees, groups like AARP. You had other groups that were representing the healthcare industry and that were providing services to our senior population, or those that actually represent workers that work with the senior population. So basically a number of stakeholders from a very comprehensive set of perspectives participated in discussions, listening sessions, and sharing their thoughts for what we should or should not do in order to be effective with our rising senior population. And so this happened at the same time that the pandemic hit. So we went from having meetings that were in person to going through a set of virtual meetings. But one of the big red flags that did happen during the pandemic was a very systemic realization of the flaws in our healthcare system. As many of you may be aware, we saw a dramatic shift in the type of care that was offered or the safety that was able to be provided in a number of nursing homes, healthcare facilities. Our senior population was really disproportionately impacted by the pandemic, which did change the conversation that was taking place with the Master Plan on Aging. So hopefully this has helped to create a more effective set of recommendations for moving forward. So I wanted to at least lay that blueprint to give you a sense of the type of issues that they were chewing on that ultimately led to this next set of goals that they set out for California to achieve by the year 2030. So the 5 goals that they're setting out for the state of California is to provide housing for all ages and stages. As you all know, seniors are not all in their 60s, 70s, 80s, 90s, or even 100. We have seniors across the spectrum that have different needs. That also means they have different housing needs as well. So there is a realization that California needs to do a better job to provide housing for all stages of our seniors and our aging population. California needs to reimagine the health and quality of life. What does the quality of life look like, and what kind of quality of life should we be preparing our state to provide our seniors? Number 3 is how to provide inclusion and equity without protection from isolation. We've really seen isolation impact so many of our senior populations due to the pandemic, and it's made the mental health issues even more important to address. So that the pandemic really did have an influence on number 3 with protection from isolation. Number 4, effective caregiving through high quality caregiving jobs. There is just a shortage in the caregiving population, and it's going to be an even bigger issue as we see the senior population expanding. So this is going to be a major issue that's going to need to be addressed as soon as possible. And then finally, affordable aging by closing the equity gap in elder economic sufficiency. So I'm going to go over each of these 5 goals with specific recommendations on what the Master Plan on Aging is included. And then we're going to cover next steps. How are we likely going to see these different steps integrated into California's statute and overall budgetary goals? So let's start out with the first goal, and that's housing for all ages and stages. So there were a few different goals that are included for housing, and that's a goal of millions of new housing options for older adults. Now, this is extremely ambitious, and this is also extremely complicated because if you've spent any time listening to the news lately, you'd know that California has a serious housing crisis. We have a crisis where we don't have enough homes for the individuals that we have out there. We don't have enough affordable homes for individuals at all ages and stages. And you typically hear this discussed with our active populations. So you hear about this when they come to working families, but what we don't always hear about is the need to have affordable housing options for our seniors. And one of the significant reasons why, and I'm also going to touch on this later on, is unfortunately we are seeing an increasing amount of seniors that don't own their own homes. That is a major shift in some of the demographics that we've been seeing. And so because we have more seniors that don't own their own homes, having affordable rental options is actually becoming a very large, a much larger issue than it has been in the past that's impacting our seniors. So creating that goal of having more housing options is becoming increasingly relevant for our senior population. And then also to really reimagine housing and housing sizes that provide effective transportation options. Are you close to a park? Are you close to a public place? And how do we do that in an environment where we're having to adapt to climate change? So the reality is we know that there are households that are combining. We especially saw this because of the pandemic, where either grown children are moving back in with their parents, or parents are moving in with their children, which means you need houses that have more options for individuals to live in, and also ensuring that you're going to be able to have more access to public places. Are you, as a grandparent, going to be able to walk with your grandchild to the local public park and play? Are you close enough to do that safely? Or are you close enough to public transportation where you're going to be able to access the transportation that you need to get to where you need to go? Some of those options that they've been including in housing considerations are the need to include duplexes and accessory dwelling units. That's been a big issue that we've been seeing. Sacramento's been discussing changing some of the codes and statutes that we have at the state level to ensure that it's easier for individuals to build accessory dwelling units. Because we're seeing multi-generational families living together now. And then we're also seeing a need to have increased access for caregivers to not just work during the day, but some caregivers that are actually living with the individuals that they're helping with. So that does mean that we sometimes need to reimagine or change some of the housing units that we've had in the past. As we're building new residential communities, are we able to build that from the ground up? Sometimes it's easier to build from the ground up as opposed to changing what we already have. And as you all know, sometimes change can be very difficult for individuals and with communities. Some communities are having a very easy time accepting accessory dwelling units. Others are saying, wait a minute, you're creating communities where we're having, it's becoming more crowded. It's creating more parking. So as you begin to integrate one aspect, you then also have other issues that have to be addressed within the communities in which you live. So these are not all easy conversations that can happen with the snap of the finger. It's really reflective of a change in thinking and a change in culture that our state is beginning to grapple with, and how we move forward is going to be a very complex discussion. While Prop 13 did have an impact on property taxes, one of the policy issues that we're realizing needs to be discussed that hasn't been discussed in the past as much is it's discouraged a population from moving. And so we've had a number of individuals that have not moved because they didn't want to get impacted by shifts in property taxes due to Prop 13. But now what we've seen is a number of seniors are now in communities where the rest of their community has shifted. They may not have the access that they used to have to public parks, easy access to public transportation, whereas if they would not have been impacted the same way, would they have considered moving into an area that would have actually been a better fit for the long run? How do we broach that conversation, and how do you do it in a way that's not going to negatively or financially impact those seniors who don't want to see any changes to their property taxes? Because that's a huge issue for those that do have their own homes. But I did want to note that we have been seeing more seniors retiring who are not homeowners. We have seen so many very complex economic situations faced by our current and retired teachers. And we're really seeing the economy shifting. And the economy, as you all know, has not treated everyone equitably. And even in our senior population, we've seen a lot of inequities because there are a number of retirees who simply can't afford their homes. Or had to let their homes go during the last recession. And so they're now renters. And when you're on a fixed income and suddenly costs go up, you might not be able to afford to live in the community that you were hoping on living in. And you actually have more needs and less options. That's been putting a number of seniors in very precarious situations. So how can California create policies as they're trying to address this housing shortage that not only helps those that are actively working, but also takes care of our retirees who don't have as many options? One of the big options that policymakers in Sacramento are trying to grapple with is the lack of adequate public transportation and transportation options in general next to a number of residential communities. What we have been finding is that has been a detriment to giving seniors access to the community, and that lack of transportation options has also had an impact on having seniors be increasingly isolated. That's also had both health, physical health and mental health actions on the retiree population. And so that is going to cause, we're hoping, a change in the kind of policies that are going to be discussed and created at the statewide level. But this is all very substantive information. It's hard for policymakers to already grapple with the housing crisis that they're dealing with in Sacramento. Now, when you throw a number of these nuances into that conversation, it makes those already difficult conversations even more difficult. So ensuring that we're paying attention, that we're chiming in as needed in Sacramento is really going to be important as we're seeing a number of these conversations integrated into the conversations and recommendations that are taking place in Sacramento. So that was the first issue. Our second issue is reimagining health. Healthcare and healthy aging are major priorities for CalRTA, and it's a major priority for the state as well. One of the recommendations from the Master Plan on Aging is to truly reimagine health and reimagine health for all ages and stages of our senior population. So one of the first goals that the Master Plan on Aging is seeking to achieve is to create a goal of closing the equity gap and increasing life expectancy. Ironically enough, before the end of the last recession, or the Great Recession that we've had, we really saw a significant increase in the overall life expectancy, not only in our state, but across the country. And unfortunately, we begin to see some of those numbers decline. And we've also seen shifts in different parts of the population. So how can we ensure that all ages and all populations can achieve that greater life expectancy and have a good quality of life? So we've found that one of the biggest hindrances towards achieving that is the lack of healthcare and healthy communities. And various communities have better access to healthcare, better access to parks, better access to areas where you can walk, have safe air to breathe, have clean water to drink. All of those issues, depending on how much you've been exposed to some of the negative aspects of our great society in your younger years and in your working life, does have a long-term impact on your overall health. And so trying to address those issues, especially for our younger populations, so that as they age, they don't have long-term systemic health considerations that they're going to have to deal with, can have an impact on the overall quality of life. So there's much more of a realization about really how dependent we all are on each other, and ensuring that we can create healthy communities and live in healthy communities, and trying to address some of those long-term needs are going to be very important if we're going to try to address some of those barriers to healthcare and healthy communities. Unfortunately, as we're aging more as a state, what we are finding is at least half or more than half of Californians are going to be suffering from one chronic illness at least. So a number of individuals, we've seen increases in the amount of adult onset diabetes. We've seen more increases in the number of individuals that are suffering from dementia, Alzheimer's, cancer, a number of illnesses that our population has been facing. But because we're seeing an increase in the senior population, and because we're also seeing chronic illnesses impacting our population more, that means that the number of seniors that are going to need access to health care and quality health care to address those chronic illnesses, we're going to see that increasing. 9 out of 10 older adults take prescription drugs. 1 in 4 of those are finding the cost for those prescription drugs that they need unaffordable, even with insurance. This is a major issue. CalRTA has been working on trying to ensure that we can have adequate and affordable prescription drugs. This is becoming more of a crisis for senior populations, because when you're forced to actually make a decision, am I going to pay for my rent? Or am I going to pay for food, or am I going to pay for my prescription drugs? That is a moral quandary no one should have to be in. And trying to ensure that we're going to have better access to affordable prescription drugs is something that not only has to be addressed for all Californians, but we're seeing this turn into a crisis situation for seniors, because so many seniors are on a fixed income and don't have the healthcare options that they used to. This has really disproportionately impacted women. We've seen that women in particular have found themselves in need of either home care or adult day health care. And for many of you that are already on Medicare, you know that that is just not covered. There are a number of donut holes in Medicare that are not covered. And those are unfortunately the issues that our seniors really need more of. You know, Medicare doesn't cover dental, it doesn't cover long-term care, it doesn't cover hearing. CalRTA has been working at the federal level. We've been talking to members of the House and members of the Senate to try to, number one, ensure that the Medicare Trust Fund is fully paid for, because we have to make sure that Medicare is still going to be able to continue the way it has been. And additionally, we've been trying to get our members of Congress to close those donut holes in Medicare, because those donut holes are really having an impact not only on our senior population, but disproportionately on women. The great news about being a teacher is that you live longer than any other population in the nation. And 72% of you are women, and women live longer than men. So the great news is you're gonna live longer than everyone else. But what we want to try to do is to make sure that you're going to have effective and affordable healthcare options for the duration of your retirement, so that that's not going to impede on the quality of life that you have. And then finally, less than 5% of California's providers have geriatric expertise. We're seeing more rates of Alzheimer's. We're seeing more increased rates of dementia. Yet the healthcare providers we have across the state just don't have what I would use a teaching term. They don't have the cultural competency to effectively address the needs of our senior population. And so there have been conversations in the state legislature, and CalRTA has been supportive of those conversations, that would create new areas of specialties, specifically in the area of geriatrics. Wouldn't it be wonderful to have a family practitioner or doctor who is not only a specialist in internal medicine medicine or whatever it is that they're specializing in, but if they also had a specialty in geriatric care. That means that you're going to be able to get more qualified and more effective healthcare professionals at all ages and stages of your retirement career. So we are working on participating in those conversations, and we're likely going to see more options that are going to be promoted in Sacramento over the next few years. Third issue, inclusion and equity with protection from isolation. This is a much more of a complex discussion because it impacts so many different seniors in so many different ways. So one of the ultimate goals is to create a goal of increasing life satisfaction through aging. So this means that we can not only create options that are going to be effective for individuals in their 60s and 70s, but how do we create effective options for seniors who are in their 90s or seniors who are 100 years old? You know, our leaders at CalSTRS have been telling us for years how they're having to, they send birthday cards for CalSTRS members every time they turn 100 years old. And one of the things I've heard from folks at CalSTRS is how they're having to fill out more birthday cards because we have more and more of our retirees that are hitting 100 years old. But the needs of a retiree who is 100 years old is going to absolutely be different than the needs of a retiree who is 60 or 70 years old. So how do you try to create equity, and how you protect someone from isolation at 70 is going to be very different than what you would create for someone who's 100 years old. So making sure that we're able to have differentiated options in the goals and the solutions that we're putting forward is going to have a very different impact on seniors of different ages and the different senior populations that we have. While technology has been helpful, and we're using technology today to have a very unique and creative conference this year, it doesn't address the needs for all seniors. And we have so many different residents within our state who simply don't have access to internet at all. To over 2 million residents in California don't have access to the internet, and so many of our kids who have been in distance education this last year haven't had access to high-speed internet, and it's really created so many barriers that we've seen come to the forefront. But it's not only our kids and our active populations, but our retired populations are impacted by that as well. 34% of seniors over age 60 don't use the internet. And some of this is because they don't want to use the internet, and some is also because there simply isn't access. So many of California's communities really don't have broadband access, and what that means is basically you're going to have all the broadband lines in, so you can tap in. It's kind of like, think of how your sewer works or how your electricity works. You plug into that system. Same kind of system for broadband internet access. If you don't have access, you're not going to be able to get on. And so trying to ensure that we can provide that is going to make a big difference, especially when we're looking at the increased use of telemedicine. You know, if you're a senior who doesn't have access to public transportation, if you at least have broadband access, you could get telemedicine from your doctors. That's going to make it easier for you to be able to get in if that's an option that you wanted to choose. So that really opens up a lot of different options that seniors will have. But when you've got over 30% of our seniors who don't even have access, that's going to be a major hindrance that impacts the quality of life. We're also seeing our seniors working longer. Those that are age 55 or over, usually they've been compromising 29% of all new employment. So 2/3 of our older adults have also felt that while they're still going into new jobs, also feel that they're facing age discrimination when they're trying to find employment. There are so many individuals, particularly in the dot-com bust and the Great Recession, who thought that they were going to be able to retire. They made all their plans, and suddenly the economy and the stock market tanked, and so did their 401ks. So many seniors simply weren't able to retire and had to continue to work, but yet we're finding a lot of discriminatory practices in the workplace that have made it much more difficult for them to find jobs. This has also ironically had a significant impact on the younger generations, such as Gen Z and the millennials, because there are so many jobs that they would have come in to get that simply aren't there anymore, because so many seniors also need to continue to work to make sure that they can meet their financial needs. So we have a number of complexities. We have generational differences that are impacting each other that we need to try to chew on as a state to address, to make sure that seniors that need to continue to work are not going to face barriers, and that are going to be able to find jobs that are going to be able to pay a wage that are going to meet their financial needs. Finally, on this issue, what we have also seen is an age-old problem that has not been going away, that we have seen increasing, and that's elder abuse. It's estimated to impact about 10% of older adults who are living at home, and unfortunately, women are being disproportionately impacted by elder abuse, where 35% of our senior women more likely to suffer from elder abuse. Which is an absolute travesty. And so this can have a major impact on quality of life. And this is not only physical abuse, which is absolutely horrendous, but we have also really seen the long-term effects of social or emotional abuse and the toll that it's been taking on our seniors. And so trying to make sure that we have adequate protections that are built into not only our healthcare systems, but the social networks that we're creating in our state are going to be important to try to reduce the impacts and incidences that we've been seeing from elder abuse. Much of this can really happen through caregivers. And so caregiving is also one of the major issues that has been focused on from the Master Plan on Aging. And that's ensuring that you're going to be able to have effective caregiving through high quality caregiving jobs. So what California has set a goal out to create 1 million high quality caregiving jobs, because that's actually going to be the need that that our senior population is going to have. But that's a very ambitious goal, and it's hard to ensure that we're going to be able to achieve that goal unless we see some kind of systemic changes in California to help to get folks in that pipeline. So because we don't have enough caregivers right now, and we're seeing that increased need, we've also seen more families that have been moving into that caregiving role. So we've seen more children now helping to be caregivers for their parents, or more spouses. Some of you may be caring for your spouses as their primary caregiver. We have been seeing an increased need for families to step in when they either don't have access or choose to actually do that themselves. But that also does have an impact on the family and family needs. So how can California ensure that we're providing the support that families need if they're providing that caregiving, to make sure that the family needs as a whole are also being met? There are close to 5 million family caregivers right now who provide support to either their parents, their spouse, friends, and other families that need assistance. And these are simply day-to-day tasks, sometimes getting ready, sometimes it's meals, sometimes it's much more technical and functional support that adults need. But 1.7 million of them are caring for someone that's got Alzheimer's or dementia. They don't have adequate training. They don't have adequate support. So unfortunately, some of these situations have led to situations where individuals have really not gotten the quality of care that they need, and that can be disastrous, not only for the senior but also for the family as well. So how can the state ensure that as we're seeing more families step into these caregiving roles, how can we provide adequate and effective training for those families and support? But how do you do it when they're already working full time and may not just be able to take off work in order to do that? These are very difficult conversations, very complex situations. These are some of the policy discussions that our policymakers in Sacramento are going to be considering in the workforce when it comes to those that are caring for individuals. And of course, again, women in particular, and particularly women of color, are disproportionately the individuals that are providing the healthcare needs for our senior population and for our aging population. And many of these women are also providing for their own children and their own families. And so ensuring that we're able to provide enough quality caregiving jobs is going to be important, because if they can't afford to raise their own family while being a caregiver, they're going to start to look for other professions. And then that's going to lead to an even greater need of caregivers just when we already have a huge gap. So trying to find that balance is a really tricky conversation that our leaders in California are going to be having over the next few years. And then additionally, to top this part off, that's on top of a labor shortage. So we already have the shortage right now of our caregiving workforce is approximately 3.2 million workers, which means that we're going to dramatically need to increase the number of individuals that we have that can step into these roles. So if we have a need that's over 3 million, and our goal is to create 1 million high quality jobs, that means we're still over 2 million caregiving jobs short, which means that it's going to get more difficult for seniors as you might need help from a caregiver. And that means that it could impact the costs. It could mean it's going to impact the access that you're going to have to a caregiver. So making sure that we're paying attention to this conversation and participating in this conversation is absolutely important, because that is going to lead to access to a caregiver, especially through our seniors more advanced age. So it's, you might not need a caregiver at 60, 70, or even 80, but oftentimes by 80 or 90 or 100, it might not be absolutely intensive caregiving, but at least having someone come in to assist can be the difference between you being able to live at home or you having to consider going into movement with family or even in a caregiving facility, which you may or may not want to do. So having access to a quality caregiver is going to give you more life options that's going to directly impact the quality of your own life. So I'm going to try to go a little more quickly to make sure I can get through all of this and have time for questions. Affordable aging is a major topic. We not only have issues with affordable housing, but we're now seeing the issue of affordable aging become a reality, unfortunately, for so many of our seniors. So trying to close that equity gap for our elders is very important if they're going to be able to receive economic sufficiency, because we are unfortunately seeing more and more seniors that are not able to retire, but may not be able to work anymore. And we're seeing so many more seniors in poverty. So the importance of trying to ensure that our seniors can have continued economic security is absolutely imperative for all of California and for California's economy. But unfortunately, that situation is being exacerbated because we're seeing rising housing costs. People are getting pushed out of neighborhoods, and that's also being coupled by increased healthcare costs. It's simply squeezing people from both ends. That's caused so many seniors to lose their homes and be in very precarious financial situations. We've seen more seniors across our state who do not have adequate retirement incomes. As when you compare them to previous generations, you're very fortunate as retired educators to have a secure retirement through CalSTRS. CalRTA also works very, very diligently to ensure that CalSTRS will continue to be there to sustain you. But as you all know, that's simply not enough. And then being impacted by the WEP and GPO, Social Security offsets really can hit the financial security of a number of our members and a number of retired teachers across the state. This is also happening to seniors in a number of different professions, and some have had to become overly dependent on Social Security. And if you needed to be over dependent on Social Security, but then you get hit by the WEP and GPO, that can literally be the difference between pushing you off the financial cliff. Of course, again, just with the same as other issues, our women are disproportionately impacted by this issue because a number of women just don't have as many Social Security earnings as others, and then live longer as well. So it really disproportionately impacts women. 1 in 4 seniors who are over age 65 rely almost exclusively on Social Security benefits. And as you know, it's not even enough to cover. And so the reality is that's putting us in a situation where we're actually seeing a very high rise in the number of seniors who are homeless. And that's so now the issue of homelessness is not just something that happens for folks in their younger ages, but we're seeing this impact more seniors, unfortunately. California, unfortunately, does have the second highest poverty rate of older adults in the nation, and it might increase. And so what can we do to have conversations now that might be able to address this or keep this from getting worse are going to be very important for us to focus on. So the next steps, the Newsom Administration is working on putting together specific proposals. We're seeing some of these integrated into legislation that the legislature is considering now. And over the next few years, we're also going to see bills introduced in the legislature. So CalRTA will monitor those through our Government Relations Committee, and we'll take positions on those as necessary. And they're also looking at changes that can happen to state agencies that can automatically be integrated into the work that they already achieve. We have monitored this process as it started, and will continue to monitor what the Master Plan on Aging is setting out to achieve, because it obviously has a direct impact on CalRTA members. But at least the good news is we're hoping that there's a very positive boost in the economy, especially the extra resources that the state is giving, can help to address a number of the systemic problems that I've talked about today, so that we can hopefully have an increase in options that are available for our seniors. So with that, I know we only have about 3 minutes left until we're set to finish this workshop, and I apologize, but it was a lot of technical information, but I do have time to answer a few questions if there are some questions out there.
We do have one question from Rosie. As boomers will soon be a large majority in California with birth rates decreasing, where will the necessary funding come from since the workforce is decreased in the future?
Well, and that's a very complicated conversation. And you know, California's gotten most of our revenue from high income earners. And that's actually what gave us this huge $75+ billion boost in additional state revenues that we've seen this year. The question is, how long can we sustain that if we're just disproportionately relying on one set of income earners? That also causes some instability. When they win, we win. When they lose, we lose. And so trying to ensure that there's a balance in the resources. And that's also going to be complicated because we've seen that the needs of our kids have shifted. We've seen the needs of schools. Healthcare has shifted. How do you move those pots around is a very complicated and very, as you know, very controversial discussion in Sacramento. So I can't tell you exactly what that answer would be, But what I can tell you is that CalRTA is going to be engaged in a number of conversations that are going to take place to make sure that we can assess what the pulse is on that discussion, and that we can participate in a way that's going to try to meet your needs.
That is the only question that we had, but I bet we'll have more during your legislative update.
Thank you.
Half hour. So here's one real quick. Would the revision of the original Prop 13 have helped the funding of all of this?
Oh, that is not a softball question. You know, it's really hard to say, because remember, this impacts so many different issues, and you know, that would impact education, that would impact healthcare. I don't want to say it's only one thing. So what happens is folks in Sacramento try to create a perception that if we only change this one thing, it would magically address all our needs. And the reality is there are a number of financial buttons, tax buttons, that need to either be pushed, or knobs that need to be turned or turned off or added to. So what I would encourage you to do is think about a number of ways that we could see changes. That way we're not going to be overly reliant on one issue that might not always be enough to address our needs in the long run. So with that, I want to say thank you so much for joining me today, and I hope to see you in one of my next web shops.